I'm on the road.
Hi, I'm Doc Jenni. Join us in the Green Hornet as we travel the back roads of beautiful North Idaho. Every day is different, challenging, and never boring as we see all the farm animals, big and small. Hey, you're on the road with Dr. Jenni. Today we've got this 23-year-old mare who is presented with a large lump. It's right behind her elbow. It's down here where the girth goes. The owner says that it's come up pretty quickly and it's gotten to be pretty big. So we've discussed several different options for how we're going to approach this particular lump, and we've decided to go in and try and remove it. So it may be a little bit of a tricky surgery because it seems like it's fairly firmly attached, but we're going to give this mare the best chance to have a usable riding career after we get this thing off here. So we're going to lay her down and remove that lump and see what we can find once we get in there and cut the thing out of there. So we're going to do surgery in the snow. You're such a good girl. Oh, it's a little tickly. Oh, sister, I'm sorry. You're such a pretty girl. Yeah, she needs a little bit of a spa day. The odds of us hitting the blanket are pretty slim.
We're not that good.
No. You're such a good girl. Thank you for putting up with all of this. I know.
You've been gliding it while you're awake. You are a good girl.
Gonna use our anesthesia time to the best of our ability. We're gonna do 5 of xylazine. Oh, sister. I know, sorry. With 1 of torb. It's gonna take 2 of those syringes full. That's a big lump. We don't always do a catheter in a short field surgery like this, but just in case we need more time and our anesthesia runs out, I want to make sure that we've got a spot to get it in nice and easy. If I prepare for the worst, then it's going to go really smoothly. It's going to fish on out of there. Hey, Carolyn, you want to grab a surgery gown just in case it's really bloody? Good job, sister. Here you go down nice and peaceful, aren't you? Okay, take that from you. Wrong way. Let's go this way. There we go. Good girl. Come this way, please. Thank you. Good job, sissy. Good job. Looks like I got plenty of lidocaine in there. The lump looks twice as big. We should just have skin, so it shouldn't be that big of a deal. It's not like we've got guts coming out. If we end up with guts coming out, we're really in trouble. Okay, ready. So I'm going to start just making an incision across the top of it, see if I can dissect it from the skin. If it doesn't dissect from the skin, then I'm going to have to take the skin with it, which is going to leave a great big hole. So hopefully, we'll see what we got here. So far it looks like fat, which is a good thing. A little bit of fluid in there, and it's a little hollow, which I wasn't expecting. This feels like it's just mostly fat. That would be a good thing. That's not what I was expecting at all. That felt way more. That looks like it's just fat, and it's all just coming apart right under my skin here. Yeah. So let me just take as much of this out as I can. Gosh, wouldn't that be nice if it's just a fatty tumor? Huh. Not what I was expecting at all.
Are they normally that hard?
No, I can't say that I've ever had a fatty tumor on a horse, to be honest with you.
Oh, really?
Yeah. Yeah, I think so. This is... That's not fat. I don't know what it is. We'll definitely submit it to make sure, but I mean, it's friable like fat. It's the same color. The other I know. The other possibility is that it was inspissated pus, but it doesn't have the same feel to it. It's
What did you call it?
inspissated, so when you have pus that, like aged pus.
Oh, okay.
Wouldn't it smell too?
Not necessarily if it was completely closed off, like a sterile infection, but I don't think that's what this is. It just feels like fat. Gosh, wouldn't that be fabulous? After all of our worry about how horrible this possibly could be. Definitely got enough lidocaine in there, didn't I? I didn't want her to feel any of this. There's a little bit of a capsule to it with a little bit of fibrous tissue around there, but good job, sister. It's kind of embarrassing, huh, little sister? It's just fat, huh? Just a little fat lump. I definitely have some fibrin pieces that are coming through here, but I don't think I'm going to be any more aggressive based on what I'm seeing here. If something comes back from the lab indicating that we need to get a little bit more aggressive, then we may do that. But at this point, I feel like pretty. Well, that could just be just from having the tumor there. Yeah, it could be. But there aren't any deeper lumps, so even though it was pretty firmly attached, I don't feel anything other than what was just right here. It's got a lot of blood supply to it, but normal fat has quite a bit of blood in it as well. So I'm just going to close up the dead space to help us with the bleeding. It is going to want to bleed a little bit for sure, but it shouldn't be too bad to get pressure and closure on here. Good job, sister. I really feel like my lidocaine was overkill now. Yeah, I just didn't know. I've had these before that I thought were going to be super easy tumors, and then you get in there and it's a disaster. So I'm happy to have one be easy again. And there we go. That dead area is closing up now, and that'll help with the bleeding and swelling. So barring any complications, this should heal within, 2-3 weeks. It may still have a little bit of lumpiness to it, but now that we know what it is, as long as it doesn't come back as big as it was, which it shouldn't, you shouldn't interfere with the cinch at all, and it shouldn't cause her any discomfort either. You can feel there's just a little bit of a lump at the very front and the very back of it that didn't fish out of there, but once the lidocaine blemish goes down, it should be at least a quarter of the size that it was. What we can tell, that lump was just fatty tumor, so we fished out most of the loose fat out of that hole, and we're going to send it off for histopathology and see if there's any follow-up that we need to do. But at this point, I think she's going to be just fine. So we were able to diminish the size of that lump. It should get it out of the way of the cinch, so she can go back to being a saddle horse and can spend the rest of her life being ridden. So we'll definitely continue to monitor this. She'll need to be on antibiotics for a couple of days, but overall it wasn't anywhere near as big of a job as we were fearing that it might be. So we'll get her back up on her feet here in a little bit, and then she can go back to living with her buddy. Hey everybody, thanks for riding with us in the Green Hornet today. This is Doc Jenni signing out. If you like what you saw, be sure and follow us in the Green Hornet with Tormund, out on the road with Doc Jenni. Just click the link below and follow us along on our journeys. See you later.